Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everyone, to the Functional Code. We are excited to bring to you guys today a new episode. This is one of several of a new series. We are going to be talking about AI, especially in healthcare, training, fitness, and medical. So today we're going to be talking about how to use AI and how can you improve your ability to change your life safely while using this technology. As always, I am Dr. Addy.
And I'm Dr. Jace. When looking at how we want to help people long-term and help them with longevity and optimize their systems, AI is now brought into our life whether we like it or not.
Right.
So it's how can we leverage that to optimize your schedules, calendars,
yes,
interactions, whether it's outside or inside your bubble. So we gotta lay down the foundation. Let's just start there. So when you look at AI, okay, AI is not just intelligence, it is a huge foundation. It's a pattern recognition system. It's also a data gathering center as well. So it can go through a lot of information and kind of personalize it to your system, your schedule, your person to help you as an assistant. And there's a lot more that's coming in, advancing day by day, week by week. It's incredible. But this is where we want to help you set up the correct, what's known as prompt engineering. Now, prompt engineering is what info can you give to the AI and how much clarity can it give you back? And that's where the specifics matter and how to set all this up, which is what we're going to bring you today a little bit more in depth. So as we're prepping this episode, obviously Dr. Addy and I, we use AI in certain aspects, but a lot of times we just rely on our cognitive processing, our mental mindset, knowledge, experience, in addition to it, not necessarily in replace of it. So that's a key distinction. So one thing that has come across is this acronym known as R.C.O.P.E or R.C.O.P.E. And as we break into the specifics of this, will help set your prompt engineering or the text that you put into AI to allow it to either ask you questions or to allow it to give you the answers that you're looking for.
And it's very simple, guys. It's really not going to be, it sounds confusing, but I promise you it is not. It's a very easy way to break down the improvements of your prompts to get much better outcomes when you're using AI.
Yes.
Yep.
Very much. So, Doc, maybe we can start with the letter, break that down, and then what's bad and what is good.
Okay, I like that. Getting into role, we'll start with R. So first and foremost, the ways that you can prep an AI to start to help you is super effective, super helpful. For example, there might be some textbooks that you're reading at the moment as a college student, and you have questions on said textbook.
Love this.
So what you could do is say, hey, you are an expert in, let's just take sociology, for example. You're reading a sociology book, you're a sociology major, and you have a question regarding an exercise in, let's say, your textbook. You then are going to say, so instead of just saying, hey, what do you think about this exercise or answer? What you would rather do is say, hey, you are a sociology expert, you are a PhD, you have read and consumed numerous textbooks, including put in the name of the textbook that you are reading, and say, how would you analyze this scenario, this situation? What are some of, and then that's how you then prep it to give you a much better answer, much better outcome.
Love that.
Now, the wrong way would just be, give me information on this, or give me answers to this. Not to say it wouldn't come up with some options or answers for you, but you're not going to get the in-depth and more clear options that it could give you if you didn't do it the first way.
Beautiful.
Yeah.
Beautiful. And yeah, okay, so as you're going through, Doc, let me just start typing in. Let me take a little bit of since our audience is maybe more on the athletic training side of things.
Should we do let's do like workout fitness. I like that.
Yeah,
The kind of the
let's
role
do
here.
that.
Okay. So the role then for, let's say, creating a workout plan or making maybe a fitness plan would be you are an expert trainer. Would you agree?
Let's
Maybe
do it.
something like that.
Expert trainer. So acting as an expert trainer with maybe a background
Yes.
in all the type of certifications maybe.
Well, see, what I would do differently
Please.
myself is I would put functional range conditioning expert because you and I are so philosophically based in that. I like how it actually can create plans using isometrics, eccentrics, loading those first. Cars, it says a lot of cars when I put those in there. So that's a nice way for me to not be like, hey, I want this and this.
Yes.
While we're doing this, it just knows.
Love that.
So,
okay, cool.
and if there is a philosophy that you appreciate, or let's say you're used to listening to certain influencers, maybe you like a certain influencer, you can say, using the tone of Dorian Yates or using the tone of C-Bum. I don't know. Just how would you put that into perspective?
Acting in place of Elon Musk.
Yep.
When looking at this situation,
Yep.
so like you're painting the frame of what lens the AI wants to look through in the knowledge base.
Yep.
Essentially,
Perfect.
and it can pull from a bunch of different information.
Beautiful.
Related to that. So
Beautiful.
Yeah, no, that's
Yes.
awesome. So role R. Next one, C, context, and this is so important.
Yeah, this is a big one.
It's the situation. It's the what are we trying to look for? It's giving the AI more description on what you want for the clarity purpose.
So Doc, when let's say now the context is making a workout plan, what would be the worst way to do it? What would be the best way to do it?
The worst way I would say is just make me an exercise plan or make me a training schedule without giving context to what does the times a week look like for you? How long do you want the workout to be? What do you want an upper body, lower body workout?
Yeah.
Are you injured in certain said area, or even more specifically, what tissue, what joint? The more specific you can be, the better output. So it can either go and help for the rehab of, let's say, for example, an injury specifically, it's going to bleed the focus specifically into that. Or it's going to help work around knowing that's involved to go either lighter on upper body workouts if it's an upper body injury, but maybe dabbling more on lower body stuff. So you can see how things.
And of course, if you're not a bodybuilder and it spits out a more bodybuilder focused schedule, you're going to have a huge issue with trying to do something
true.
that you're not prepared for or ready for.
Yes. So context. Okay, so let's say we are wanting to create a workout plan for 3 times a week, 45-minute workout schedule, workout session, excuse me. And let's say I have a right shoulder AC joint injury. Okay.
I would also put,
Please.
I am a intermediate trainer, or I am an intermediate skilled, maybe as far as working out. I don't know, how would you put that?
I'm intermittently skilled at working out.
I am,
Experience-wise.
Experience, there you go.
Beautiful.
And I would also put where you're going to be training. Because if
Great
you're
point.
not at a gym
Love
versus a
that.
gym,
Same
it would
location.
choose certain body weight, maybe kettlebell stuff versus actual cables and things like that.
Let's say in the gym.
Yeah, so
You
I
want
will
to
be
work
in a
on.
gym and have access to different machines and things like that.
Perfect.
All right.
Okay, so there's our role, there is our context, and then now is where we get into objective.
Yes.
Now, with objective, this is what you want the outcome goals to be, whether it's like what are certain things you're searching for with the response from AI. So you're painting the picture, you're giving it the lens to look through, you're painting the context on your situation. Now it's what do you want to get from it? And this is where, like, what my primary goal is. That's usually where I would start to label for most of these, or my goals are, or I'm looking to get out of this. Start that as the first phrase and then fill in the rest from there.
So one way not to do it would be,
Thank you.
my goal is to get healthy. Not quite as clear as my goal is to improve my joint health and give some improvement in strength. Someone else's goal could be, my goal is to put 25 pounds of weight on over 2 months. Because then, again, that would be much different, its response versus the first one. Another maybe bad one would be, I want to get fit. That, again, isn't very clear, and you would expect a much different outcome if you are obviously more clear and communicative about what your interests are. Now, the last thing could be, as far as goals and things like that would be, is my goal is to get me to understand working out through simple exercises first, and then I want to learn how to use more stuff in the gym or something like that. Because you could really get a lot of different outcomes doing things like that too. So,
dude, let's go. Yeah. That's beautiful. That's really good. And then let's go into the next one, parameters. So we have role, we have context, we have objective, and now the parameters. Now this is something that helps us prioritize or maybe certain things to avoid.
Yes, your guardrails.
Yes,
yep, exactly.
Guardrails would be the really good way to put it.
So you talked about this gentleman who's got a shoulder injury. Yes. What would be some other guardrail sentences that you would want to throw in for parameters?
So to be specific for that person with that shoulder injury, I'm not able to raise my arm completely without pain.
Nice.
In where my arm is coming in front of me or my arm is coming beside me as I'm going. If you want to be more specific, into abduction, or painful going to adduction. Again, more context, more specifics will help, but what are things that you should do, can't do?
I'm only able to lift 30 pounds right now.
Yeah.
Maybe as a way you could throw that as well. It probably will be the one that is maybe not the most difficult, but could be the most wordy in regards to how many parameters you want to put. Because you could probably put a lot. If you really wanted to, you could go and put what your max is for a lot of certain exercises. And here's the deal is, Doc Jace and I are just doing this as a guide, a very entry-level guide, but you'd be surprised. Gary Vaynerchuk's someone we like to follow. He's an entrepreneur, and some of his prompts are 40 minutes long because he actually talks to the AI agent using a voice memo. And so for 40 minutes, he set up his prompt and then gave it to it. So this is probably going to take us, it could take you 5 minutes. We're obviously going longer because we're just trying to explain it, but you could literally take 30 minutes and really try to lay out everything that you think is helpful. If especially you're not fitness savvy, or if you don't feel like you know enough, you could lay out as much information as you can for this AI agent, and it would very extremely help you. Now, the problem is going to come with, as we get to the end here, we'll show you some things to remember. It's not a coach. Yes. It's doing its best to be a coach. And this is definitely something that you should not take 100% with, maybe just taking it instead of grain of salt.
And I want to add to that point, too, with what Gary Vaynerchuk and how long some of these prompts can be. For some of the AIs, like for me in the past, I don't know if this has happened to you, Doc, to where I start talking, voice going through that long prompt, and sometimes it just kicks me out or it just doesn't upload everything. So the backup purposes, which I've done if I'm going to go into a longer prompt like what Gary does, I just record on my voice memos on my iPhone and then just upload that file onto the AI. So it's the same type of thing, but it's just different layout to bypass the work of, like, let's say you're talking to your phone, the AI for that long and it doesn't upload. There's some frustration with that. So learning from the mistake on that one, or just having a backup in place. Maybe you're talking to your computer but having your phone with voice memos, or vice versa. It's happened before. Maybe they fixed it, improved it, who knows?
But that is a good point, especially when you're in the car, let's say, and maybe you just want to quickly think, you maybe got an idea of what you want to talk to AI about, and so you can just record the memo quick and then add it in later. Obviously, that's super helpful.
That's beautiful, man. Yes.
So the last one would be E, expected outcome. And this is going to be what you are looking for. Are you looking for a chart that has all the workouts in it? Do you want a nice long list where you can explain that you want a link, a YouTube video link for each exercise, because you don't know anything about exercise.
Let's go with that.
And so these are all ways that you can communicate what is the final outcome. How do you want it to look? How do you want it to read? You know, is there anything else you want included that you maybe don't understand? Make it bullet pointed out, however you want it to make it look. That can be the expected output and final structure of what it looks like. And that is something that I do a lot, because when I am creating a long guide, let's say for either patients or myself, I really like charts, graphs, and things like that, because it's so much more clear, easier to read for patients. And that is something that I would usually put in a lot of my outputs, is use graphs. I'll put use graphs and charts when applicable to make it clear. That's usually one of the sentences that I'll...
I am adding in all that. I love that. Yeah, that's great.
Yeah.
Great idea. Okay, so what we have as we're going through this is the whole prompt: acting as an expert trainer with a background in functional range conditioning.
Nice.
We want to create a workout plan for 3 times a week, about 45-minute workout sessions. I have a right AC joint injury. I am an intermediate skill of experience. I'm wanting to work out in a gym that has access to machines. My goal is to improve my joint health and to put 25 pounds of muscle mass on in a year. I'm only able to lift 30 pounds on my right arm, but I'm also looking to get YouTube links related to certain exercises. I don't know how to perform certain lifts, and I want to be able to learn as I go. Provide me charts or graphs when applicable.
Nice.
Let's see what it shoots out. And this is something to where, again, the more specific you are, you can also put on the back end, ask me any other questions that will help make this as powerful as possible, or to make this...
I love that you said that, because what I'll do too is I'll say, if there's any information that you still need, please ask questions on, or if you're missing anything else, don't create that yet and ask me instead.
Yeah, don't proceed before... Yep, that's a great idea. So as you're looking at pretty much the screen above, you're going to see that it's thinking, it's putting together all sorts of, again, information, the brain.
And that's great. Seeing that, because you know that now it's working.
Yep.
It's working hard to make sure.
Thinking.
Yep.
Now,
that was this is off topic, but I was thinking about that the other day. I wonder, do AI engineers agree or disagree with the fact that AI can think?
Maybe. The question is also, with a new, let's say you open up a new account for ChatGPT, Gemini, Claude, either or. When you first start it, yes, it has the thinking, but do you have to give it the parameters in order to think on its own?
Right. What is computer thinking versus human? Like in terms of, that was my biggest question. I'm like, does it think, or does it do its best to emulate how humans think?
Ooh,
and what word could you then use? Because if it's not thinking, what is it doing? I don't know. That was just something that side topic.
Ooh, that's beautiful.
All right, what do we got, Doc?
All right, so what we have on the screen, it popped out a little bit of a chart. So the chart is the targeted working sets per week is on the vertical axis. The horizontal axis is the number of weeks. It has pointed in blue lower back, the orange pull back, and then green push. So I like the push-pull aspect. So from here, there's no green actually on this. So I would go back in and say, there are no green points. Can you help clean this up? And then it's going to go back through. But for the sake of going through this...
Like we're showing you now, it's not perfect. You might have to work with it a little bit. I do see, though, it does have kind of a cycle where it allows some gradient exposure to stimulus, drops you down to give you a rest, and goes back up again, down. I like that. I like that it does that.
It's smart on how it put that together. And then as it goes through, it's giving us the amount of days per week. It's going into just more targeted working like sets of that week, and then backing down. So that's specifically what Addy was saying on that. And then it goes into other stuff on areas to avoid that can cause aggravations, like wide grip, deep bench press.
I like the pain roll. I like that it gave you that a reminder
Yes.
if it's worse than this. That's great.
It goes into more specifics on FRC joint prep.
Love that.
Every session.
That's my favorite.
God, yeah. So
Since it already just puts it in there for you, that's my favorite. So
it has everything from day A to day B to day C, and then it even has YouTube links involved, so you can tap on that. It'll pop up a video. We have some lovely ads, but learn how to do landmine overpress. So you can see how it starts.
And was it
to
accurate?
help.
Was the link accurate to the?
Yeah.
That was. See, and that's
the most part.
there's some times where the links don't quite match up, so you just have to be cautious. But
It goes into a how-to YouTube technique library. Start here to learn.
ours, great.
Perfect. So yeah, all these. And then it asks questions at the end. What I need from you to dial in this. And it goes into what movements currently flare the AC
Nice.
joint, bench,
Okay.
overhead,
Nice.
push, flies. And if you don't know what those are, you can say, okay, related to question 1, what is flies? Question mark.
Yep.
It'll go specifics, and before moving on, it's going to find the answer and then give you more in-depth context.
Nice.
And then you can say, okay, give me the calendar or give me a schedule for a 8-week period, and then it'll break down every week sets, specific exercises. So yeah,
Yes.
this is
So at the
spot
end here,
on.
Doc, question 3 I think is
Please.
important too. You want to go ahead and read that one?
Yeah, current body weight and whether you want lean gain approach or accept some fat gain to pursue the 25-pound muscle. Now, yeah, you're gonna probably want lean gain more so than fat, because if you want to gain like weight, fat mass is going to be easier in our society in America right now comparatively, because then you have to look at your diet and nutrition even more specifically, and then get into more specifics.
Putting on 25 pounds of muscle, that's a little
is a lot,
tough.
yeah.
There's not many that can probably do that in a short period of time.
in a year.
In a year?
I gave it, yeah.
For sure, for
It's
sure.
possible.
Yep.
Another aspect we probably should put on: male, female, age. That could be more in the context.
Yeah. Yep.
In the second part, I am a 30-year-old male with intermediate skill of experience. So you can kind of see and start as you're learning through the prompt itself. It kind of paints the picture. Now, let's take a step off to the side. Okay. Instead of going through this specifically, which naturally has a framework for most people on this R.C.O.P.E, R.C.O.P.E if you want. Now, the other aspect is ask the ChatGPT, make me a prompt, and then give it all the context. This is what I want. You're still going to have to paint the picture. And then say, before moving on, ask me any questions related to this that you need to know to make this prompt the best it possibly can.
Yep.
And
Kind of
that's
work in
where-
reverse,
Yes.
where you let it set up the best possible scenario for you, and you just answer its questions. That's good too. I've done that before.
And so you can actually create what's known as a master prompt. So it'll give you a document, and you can upload that document to any other file that you're working on. So it can transfer some information from different chats of AI, and it can work across all platforms from there. So more or less, it's going to ask you a bunch of questions. The more in depth, the better. And as you get done with that master prompt for yourself, like who you are as a person, like for example, on the screen here, I have a master prompt more related to the chiropractic work side of things. It goes through the 3 pillars on clinical decision-making, context creation, personal optimization. So what are your goals? What is your experience? What are your ambitions? And it has on here chiropractor, clinical director, educator, podcaster, optimization thinker. And it even goes in depth on what are some of the attributes I have. What is my worldview, clinical worldview? It goes into a bunch of different aspects that you can have with you. And you can not only do this for work, you can also do this for home, your personal life. If you create one for work, if you create one for your personal life or you as a person, you upload those 2 together, and maybe you want to optimize your calendar. There's a lot of AIs, especially if you're using, let's say, for example, Google Gemini. You upload these files on to a chat, and again, give it context, and then it can actually correlate with your Google Calendar and upload and be more specific on optimizing your calendar for what is the work times, what are the times that you have free time, that how do you feel on that day? Do you want to go into small tasks? Do you not? So it can actually act as some sort of like a therapist slash barrier for optimizing your mental your mental load as well.
That's awesome.
There's, yeah.
I know there are
There's a
some
lot.
softwares that you can use that have AI integrated in with it that do something similar, but I haven't used them yet.
Oh, yeah.
But I know that if you didn't want to have to pay for any of those, that could be a great way to do that too.
100%. And this is where we've talked. I've created a whole like architecture for like certain designs of my like schedule calendar, gave it like my work hours, and then it also gave me, okay, we want to set up 3 chats or 3 GPTs, and first one is going to go off of your mental mindset, so we're not overwhelming you with extra work.
Nice.
So that's the part that you check in with it daily. Like, for example, I set this up last weekend. One of the chats I had, and it usually says, okay, check in the morning. It gives you, okay, breath work. It says, okay, focus on maybe a small task and get ready for the day to ease into your day. Or light movement with breath work, and then goes into your day. Or even at lunch, I have a video recording session at 2 over lunchtime, and then this evening I need to do some prep work and set up for podcasts for the morning tomorrow, ideally working out legs this evening. And so it keeps that in its memory, so when you're having conversations with it, it can understand what are certain things that are needed and then what are certain things that maybe are not.
Dang,
so
that's very cool. I haven't played around with that yet, but that sounds very helpful. All right, Doc. So basically, before we end today's podcast, there's just a couple things I know you and I wanted to give these listeners before they start getting into using AI for their own healthcare. And for the biggest one, you had provided some studies here, which I think are great. It basically just shows how much more efficient AI is starting to become versus your typical practitioner. And a lot of practitioners are probably going to watch this and hear this, and they might feel threatened but I don't think AI is coming for your job, but what it might come for is just a super helpful tool.
yeah.
And I want providers to lean into that and not feel like you're going to be replaced, because I don't think that'll ever happen. If it is, I think there'll always be novelty in the person to person, and I don't think any technology is going to replace that. I really don't.
At least not for a foreseeable future.
Yeah, for sure. But basically, the couple things that I wanted to point out was, number one, studies showed that, so skin classification, like skin cancer and other lesions on the skin, they matched AI versus dermatologists, and it actually found AI was just as accurate at classifying these skin lesions compared to the dermatologist. So again, a great tool, knowing that, let's say, hey, for some reason, and unless you're perfect, which I mean, I know I'm not, but you have questions sometimes. Whether for us, we see something on the x-ray that is just like, I really could use a consult. You and I call each other, obviously.
Yep.
But it'd be nice to just quickly have some type of software to where, hey, give me your analysis on this. What are you observing? And is there anything that you're seeing that maybe I'm not? And you're confident knowing that it's accurate, which is helpful, because if it wasn't, then obviously we wouldn't want to use it. But Doc, have you ever played around with anything like this before?
Not necessarily, but fascinating enough, there's an image on X-ray I have a patient of.
Yep.
That in my mind right now, I'm like, I want to try this.
For sure. And that's the only other problem is, for us, we have HIPAA compliance. You have to worry about using anything like that. But I'm curious if there's ever going to be an easy to use software for providers to start to use this stuff. But in terms of even patients themselves, putting the images of themselves up on AI, asking what it thinks, and then going to your doctor and saying, hey, for my research, this is what it was showing. Do you agree? Is this something that I need to be concerned about? Do you feel like that's a helpful step for them?
I think that is a really good proactive step. And this is something not necessarily to replace providers specifically, but it's to give them context on, this is your understanding, this is what I've gathered from my research, what is your thought process? And then as the patient asking, okay, how did you come up with this? What is your thought process behind the diagnosis? It just opens up more context and clarity instead of people just following, oh, he's a doctor, got to go with what he says based on
Yep.
like limited knowledge at that base, but with limited knowledge wiped away, it opens the landscape, but that has to allow for more open dialect.
And if you look at the hard facts, time and time again, research has shown about 1 in 5 diagnoses are wrong.
Yeah, it's
Is that about right?
It's up there.
Yeah.
Yeah.
And that's not saying anything negative towards providers. It's just that there's a lot of complexity in conditions, and we're not perfect. And it's hard to diagnose some of these things.
And even on that topic too, like, yes, there might be a diagnosis, but it might not be the primary diagnosis, what's bringing you in, or that's maybe more
The root cause is what you're saying.
the root cause
Yeah.
of alarming.
Yeah.
They might be talking like secondary, tertiary type of diagnosis,
100%.
and that's another aspect that
Point.
what is going on, and that's where the open dialect is. Because with most practitioners, especially the experience, we've seen repetitive cycles. We've seen what certain presentations look like, and obviously there's their own little twist to it based on person to person. But you start putting those pieces together, that's where AI over time, it doesn't win right now.
No,
maybe over
no.
time, but tough to say.
For sure. And then the only other thing too is you got to understand the information the AI was built on. For example,
Love this.
if you are up to date on the kind of models that AI was being fed, you'll find that a lot of the literature is really centered around people that can afford it, people that can actually fund studies. And you'll find in our space, although it's growing, our body of research is definitely growing, and other alternative health studies are starting to improve and get larger. But for the most part, the large body of evidence is mostly on medications and elective surgeries and maybe other things like that. So what you're going to get when you ask questions, the AI is mostly fed those kinds of large bodies of information. That's all it has to choose from to give you information back. So what you ask it, its bias is going to be towards what it has to give you. You can't just come up with information out of thin air, although we would love for that to happen. It can only feed you what it's been fed. So when you think about it, we don't have a large body of evidence compared to modern medicine. Its ability to give you the answer you want might be different from an alternative health standpoint versus drugs or medication might be. It's a huge body of evidence regarding that. Doc, do you have anything to say on that?
Yeah, and correct me if I'm wrong, because I know I've dabbled into this. You, in your own respect, I'm sure, when we go back through the prompt, R.C.O.P.E, like the role, acting as, let's say, a specialist in this area, world class, looking at the context, all the specifics, yada, yada. But even looking at the role of that person, the information is still biased.
Yep.
Have you noticed that yourself?
It can be. Basically, the best way that I can phrase it is there's a lot of gray in alternative health, but it doesn't mean they're not safe.
Yes.
But because there's zero like let's say grounding. Like grounding is super safe. You take your shoes off, you go and try to, you feel good. There's no real negative safety profile issue with grounding. Now, some people believe it happens and helps, some people don't, whatever. But if you were to ask, is grounding in an evidence-based way to improve your health, it's going to probably say no. So again, you have to make sure you understand who you're asking. And if maybe you do want to use the role, like you said, say, hey, I am very alternative health focused. I am looking to see if there is any information at all regarding grounding. You can even mention knowing there's not a lot of evidence on it, but I still want to try it. What are some things that you can tell me to help me do a good grounding session? Something like that.
And from my perspective on that too, like I've tried this with, asked it, looking at the role of this. It didn't give me too much information, but I asked on ChatGPT where most of knowledge-based storage, and I use it more often, and gave me more information from our past podcasts and information that were gathered and collected. So that goes back to the memory, data storage, and then processing center. It's like you have to accumulate some of these. So in my mind is, if you're going to use AI, you got to also have some of the in-depth knowledge. So this is an awesome resource for the audience of take a transcript of our previous episodes on maybe certain topics or others on the web, input it into the AI chat box, saying acting as the specialist, looking at this situation. So that would be another way that you can back engineer some more information that can give you that's maybe not provided to most people.
Yeah.
But yeah.
Yeah.
It's interesting.
It really just is going to depend on the language model itself. You'll see in the future, though, people building their own language models, which is something Doc and I'm sure we'll get to at some point in our life. We're going to probably conglomerate all of the information we've spoke about, and eventually there'll be a functional code AI bot. I don't know. I could foresee that. Yeah, I could foresee that happening.
Yeah, Hermosi did that with his last book launch, and he has a whole AI bot. And then if you have any questions related to that, you just ask the AI. So it's, again, that data storage.
Love it.
It's a similar thing that I think most people could probably create even right now. But
it would take some time if you haven't started. But if you have, if you record your phone, let's say you're a salesperson and you record all your phone calls, well, put them all in there and then say, hey, what are some ways I can be more engaging, hooking the client? These are all things that can be helpful.
But thought about that, man.
Yes. Alrighty. Is there anything else you want to talk about?
No, that was beautiful.
All right.
Yeah. Use AI safely, smartly.
Yes. By no means is it the expert, but it is a helpful tool. And if you do always have questions, always report to the expert, because more than likely we're going to have a much better and clearer way to go through the information that you find on the internet. Because a lot of the times we know, because we've heard it, if you have an issue, you Google the symptoms. That can get pretty hairy if you don't have a helpful way of understanding it. As always, I'm Dr. Addy.
I'm Dr. Jace.
And you guys have your good rest of your day. All right.
Doc.
Oh, sorry. I didn't see that. I'm sorry.
I'm clipping that up, but that's funny.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.